The current tools for tracking cancer are not always sensitive enough to answer the most pressing question. Is the cancer gone?
We're kind of shooting in the dark. We're treating patients based on what seems to work and our best guess.
Researchers believe this new test, using just a teaspoon of blood, may be able to detect cancer before it shows up on scans.
It will give us a non-invasive or non-painful way of monitoring a cancer, following a cancer day to day, week to week, without having to do repeat biopsies.
Cancers can shed cells that circulate in the bloodstream at extremely low levels. This technology finds them by passing a blood sample through a microchip coated with antibodies that bind only to the cancer cells. The test can recognize a single cancer cell among a billion normal ones.
That would be most help for patients with prostate, bladder, colon, kidney, and lung cancers, in addition to breast cancers. In many ways, this serves as a liquid biopsy.
In addition to finding recurrences sooner, the test may allow doctors to examine the cancer cell itself and tailor therapies to a particular patient. 5 sites across the country are beginning to use the new test on patients. The research is supported by a $15 million grant from Stand Up to Cancer.
And if we only had a way of measuring cancers as they're being treated, seeing how they respond relatively quickly, and adjusting our treatment depending on how the cancer responds, then it would be a different day for treating cancer.
If all goes well, the test is expected to become widely available in 3 to 5 years. Katie?
And John, this sounds very promising for determining if cancer is spread, but is it going to be able to diagnose certain cancers in the future, perhaps replacing mammograms and other screening tests?
That is the hope, but we are still so far away from that. Right now, the idea is, in addition to searching for the spread of cancer, to actually capture the cancer cell. You've got it in your hand, you can interrogate it, you can examine it, you can say, what are the weak spots, and then change your therapy accordingly.
I was going to say, and maybe it'll lead to new treatments as
Absolutely.
well. All right, Dr. Jon LaPook. John, thanks so much.